Live from Victory Park, this is Good Morning Texas.
Pain, numbness, and tingling in the hands and fingers. Millions of Americans suffer from carpal tunnel syndrome. Women are 3 times more likely than men to develop it, and the risk goes up as we age. The good news, there are effective ways to treat it, and joining us this morning is Dr. Cameron Atkinson of BAYLOR Orthopedic and Spine Hospital at Arlington. Good morning. Glad to have you here this morning.
Good morning. Thanks for having me.
We've all heard of carpal tunnel syndrome, but exactly what is it?
Carpal tunnel syndrome is an incredibly common problem where essentially you have a pinched nerve in your wrist and you have numbness and tingling that can really affect your life.
So it's essentially a pinched nerve?
100%.
How common is it?
About 3 to 6% of adult Americans suffer with this, so incredibly common.
All right, and I've heard various things about what causes carpal tunnel syndrome. What does cause it?
Carpal tunnel syndrome can be caused by many different things. Arthritis, age, unfortunately, rheumatoid arthritis, gout, and repetitive motion is implicated. That's
what I was going to ask you about, because that's the cause that I have heard about. So you hear about computers and things like that. That is true.
There is good science to support that computer work, assembly line work, vibratory equipment can contribute to carpal tunnel syndrome.
Okay, so let's talk about the most common symptoms that come with carpal tunnel. What are they?
Pain, numbness, and tingling. It's almost always worse at night, and it can bother you when you drive, when you do your hair, things like that.
Why is it worse at night? Just because you're not doing something else and you notice, or?
That's part of it, but also swelling. You lay down at night, the swelling kind of goes throughout your body as opposed to being in your ankles and feet, and that swelling increases the pressure on your nerve.
Well, how do you know if you have this kind of pain? Obviously, no one wants to be in pain, but sometimes you think it'll go away or it'll get better. How do you know when you should see a doctor, when it's worth that visit?
The time to see a doctor is when you've had numbness and tingling that bothers you for more than 2 weeks or so, especially at night, or if it's affecting the way you go through your day-to-day activities.
Is it possible that it goes away?
It's possible, but very unlikely.
So once you have it, probably need to go get it fixed. So how do you diagnose it when someone comes in?
Every diagnosis starts with a history and physical. We bring you into the office, we examine your hand and wrist, we talk to you about the things you do during the day, what kind of work you do, and then we may send you for x-rays and a nerve test.
So then once you're diagnosed with it, can it be treated without surgery, or what is the treatment? I don't know.
Treatments come down to changing the things you do, things that increase the pressure on your wrist, wearing a brace or a splint at night decreases pressure on the wrist, and we can even give you steroid injections into the carpal tunnel to calm down the inflammation.
So it doesn't necessarily need surgery. You can change some things, and that would be great. If you do need surgery, what are the options and the outcomes?
There are 2 main ways of treating carpal tunnel syndrome in the operating room. One is a small incision in the palm where we open everything up and release the thick ligament that goes over the nerve. The other way is one or two small incisions. We use a camera and a small knife to release the ligament.
And as with so many things these days, microsurgery and all that has made it so that these things aren't really that complicated.
For a qualified hand surgeon, orthopedic surgeon, not complicated at all.
Okay, and you said a qualified hand surgeon or an orthopedic surgeon. Why should patients come to a specialist at BAYLOR Arlington?
Because we're a one-stop shop. We have 12 experts in hand and wrist care. We have a pain management center. We have therapy on site. We provide patient-focused, individualized orthopedic care that you can't get anywhere else.
That's a good reason.
Very good reason.
Thanks so much for coming in.
My pleasure.
A lot of people, bothers a lot of people. If you want more information on carpal tunnel syndrome, you can call 855-41-ORTHO for more information, or just go to BaylorArlington.com. BAYLOR Orthopedic and Spine Hospital at Arlington is open 24 hours a day, 7 days a week.